Support comes from Thomas Nelson Community College, now becoming Virginia Peninsula Community College, the first choice to start a bachelor's degree since tuition is one-third the cost of four-year schools. More at tncc.edu.
Support comes from Hampton Roads Community Foundation, carrying out your charitable wishes forever. Whether it's helping shelter animals, feeding the homeless, enhancing the arts, or supporting students. Learn more at leaveabequest.org.
Hello, everyone. I'm Barbara Ham-Lee. February is American Heart Health Month, and our favorite cardiologist, Dr. Keith Newby, joins us today with some real talk about African Americans and heart disease. Are you aware that Black people are 30% more likely to die from heart disease than whites? Hypertension, diabetes, obesity, smoking, they're all serious risk factors for heart disease, and so is inequity in treatment. But there are some things we can all do to protect our hearts, and we'll talk about it next on Another View, right after this national, regional, and local news from NPR and WHRO News.
Discussing today's topics from an African-American perspective, this is Another View.
Good afternoon, everyone, and welcome to Another View. I'm Barbara Ham-Lee. President Biden is set to address the nation at 12:30 today on the Russian invasion of Ukraine. Now, we're monitoring the situation here at WHRV, and we will bring you the latest, bring you the president's address when it happens. But in the meantime, I want to ask you a question. When you look in the mirror and know that you've gained weight, do you ever think to yourself, I wonder what this extra weight is doing to my heart? Or how about when you douse your food with salt before even tasting it? Or when you light up that cigarette, does it ever cross your mind that you're hurting your heart? Probably not. Most of us live in the moment and really don't pay attention to how our habits affect our health. But our guest today will tell you that it really does matter because he sees the effects of our habits on our overall health and on our hearts. Please welcome our favorite cardiologist, Dr. Keith Newby, who also serves as the Director of Health Equity for Sentara. How you doing, Dr. Newby?
I am doing well. How are you doing?
I'm doing great. I know you are really happy because you actually get to talk about your specialty today.
I know. Listen, I tell you, I've talked this. I'm vaccinated out, but yeah. I always say we're going to do what's in the best interest of our listeners and our community. So if it means I got to talk about vaccine for another 20 years, I do what I have to do. But Absolutely. Today, we're going to relish in cardiology.
Yes, we're going to relish in cardiology. Absolutely. So I have a question for you to start off with. So what is the common denominator among all of your patients who have heart disease?
Not listening to me.
Okay, that's a good one.
that aside, I tell you what I tell you that I don't think there's as much a common denominator, but I tell you one of the more pressing issues, and I will leave it with this one word, and that's obesity. And the reason I say that is because obesity lends to these other medical conditions, which lends to heart disease. You know, because typically if you're overweight, characteristically, not always, but characteristically, you're going to run into issues with high blood pressure, diabetes. The cholesterol is going to get messed up, which leads to a potential heart problem. So that is one common denominator, but that's not everybody, you know, because everybody's not obese. We just have it as one of the problems. But if you ask me that question, I would say that's probably one of the more common denominators, but there are other ones too, but that's the more pressing one we see.
So when we talk about heart disease, what are we actually talking about? It's more than a heart attack, right?
Yeah. So, you know, this is what I do when I give talks on this. I you know, if you look up the definition, because heart disease, that's like if you say the word car. You know, you got a Pinto, You know, if you don't know, you remember those.
I remember those.
You got a gremlin.
Yeah, whoa.
Or you could have a Lexus or a Chevrolet or a Toyota. So that's so that's a broad term. So when you hear the term heart disease, what I define it, and you look it up, this is what you're going to see, is anything that affects the heart or the great vessels. So when we say that, we're talking the aorta is your main artery that comes out of the heart, and that has side branches or off branches. It's going to go up to the brain, and it's going to go to your GI system, your lungs, your liver, your legs, and all your muscles. So if something affects, say, your brain, say you have a stroke, that is a form of heart disease. Why? Because the heart attaches to the arteries that go up to the brain. And what is a stroke? That's an occlusion of a vessel going to the brain. So anytime you hear those terms, they're all considered a form of heart disease. So, and I like to also define it where I do a lot of analogies when I'm teaching patients about their hearts. So I usually will akin their heart to like a house. And I say, okay, in your house, you have your floors, your ceilings, your walls, you got rooms, you have doors that open and close, that go from one room to the next, you have plumbing, and you have your electrical circuits. I say, well, look at your heart as like your house. So you have your rooms in your heart, which are called chambers, and you have doors that lead from one room to the next in your house, where you have doors that open and close in your heart called heart valves. So you could have a problem with the structure of your heart, which may lead to heart failure. You could have a problem with your heart valve if it doesn't open or it doesn't close right, and that could lead to a form of heart disease. If you have a plumbing problem, that's like coronary artery disease, which can lead to heart attacks and things of that nature. And you can have an electrical problem, which is called an arrhythmia. So like when you see your lights flicker in your house, you turn on your lights, you hope you paid your light bill, and you could with that. But what can happen is, think about if you have an electrical problem. You hear the term cardiac arrest. That's different from a heart attack. And a lot of people will interchange those two, but they're two different terms altogether, and they mean two different things. Cardiac arrest is when you actually have a heart rhythm problem that's not compatible with life. So you hear the term like ventricular fibrillation when those TV shows when they run in their room and they rub the paddles together.
Right, yeah.
And those are called defibrillators, and what they're designed to do is to try to re-jump start your heart, so to speak. So it's like your connecting your cables to your car, and that's what deals with a cardiac arrest. But coronary disease or blockage in your artery is like when we have to do stents. Somebody comes in with an acute heart attack, and we have to take them to the heart catheterization lab and open up that vessel acutely. That is a coronary disease problem. So it's like if you turn on your water faucet and no water comes out. That would be deemed like a heart attack.
Wow. So, I was reading some just a bunch of different things about the heart and so forth, and heart disease in Black women in particular. So listen to these stats that I found from the American Heart Association. They said cardiovascular disease kills nearly 50,000 African American women annually, every year.
Yep.
And, of African American women ages 30 and older, 48% have heart diseases. Only 1 in 5 African American women believes she's personally at risk. Only 58% of African American women are aware of the signs and symptoms of a heart attack, and only 38% of African American women know that heart disease is their greatest health risk. Why are Black women so susceptible?
Well, a lot of it is because of those risk factors we talked about. When you talk about this is what I've run into, especially with our folks, is when you start talking about chronic illnesses like hypertension or diabetes or cholesterol elevations, or even you talk of genetics. You can't run from your genetics. You can try, but you can't run completely from them. You can modify them, but you can't run from them. But these chronic illnesses, when you talk about high blood pressure and diabetes especially, which has almost a 50% risk, or actually a 65% risk of having some cardiac event if you're diabetic. The problem is that when you look at those types of illnesses, they are characteristically asymptomatic. And when I say that, think about it like this. if you come to your doctor and say you have a urinary tract infection, or you have a pneumonia, you feel bad, you're coughing up stuff, or you're burning when you urinate, and you just feel like just a hot mess, got a fever 102. Somebody gives you a 10-day course of an antibiotic. What's the likelihood you're going to take it? Pretty high.
Yeah.
It's going to be pretty high.
Because you don't want to feel like that anymore.
Yeah, you don't want to feel like that anymore. So you start that antibiotic, and then think about it, by day 5, say you feel better. You feel like back to your normal self. Will you finish that next 5-day course, or will you stop at day 5 because you feel better? You run into the issue when you feel relatively well, what you do with hypertension, generally speaking. That's why they call it the silent killer. You feel generally well with diabetes unless your blood glucose is ridiculous. When I do have a few like that. Yeah. Characteristically, you will not feel that. So if you don't feel that, if somebody says, you have, you take this medicine and you need to take it every day, but I feel fine. What happens characteristically is those patients are going to, they're going to say, I'm not going to take this, or they won't take it like they're supposed to, not because of a lack of desire, but to be honest with you, for a lot of people, it's hard to take something every day if you generally feel okay. You just, in your mind, you just almost like, well, I don't understand why I really need this.
Well, Keith, I have high blood pressure, and I take my pill every morning at the same time. I mean, it's a part of a habit, like when I get up to brush my teeth. I mean, it's I had to work it into my day so that I wouldn't forget, number one, because I realized that it is something that is helpful so that I won't get heart disease, hopefully.
Okay.
Hopefully.
Okay, so this is the thing, though. You're only one of a few,
right?
that will do that.
And
I mean, you're only one of a few, unfortunately.
Wow.
So it's hard to get. I mean, that is like the bane of my existence. I'm not going to sit here and lie to you. Trying to get people to understand, or somebody would say this to me, and I give a prime example. I had a talk on Sunday. I did it at a church in Suffolk, and we did a good discussion about heart disease. And I heard somebody, I couldn't help but laugh to myself when this young lady said it in the audience. And I asked, what's the definition of hypertension, or high blood pressure? What are the numbers you need to look for? And we had that discussion, and I said, well, is this number good? And I said 138 over 84. And some lady said, yeah, that's good for me sometimes. Oh. And I looked at her. I said, no, that's not good for you anytime. But there are people who have it fixed in their mind that if their blood pressures have characteristically been 180 over 100 and they get it to 140 over 90, that's good. Now, it's better than 180 over 100, but it's still not normal. If you look at 140 over 90, your risk of heart attack, heart failure, if you have a pressure of 140 over 90, you have a 50% risk of developing heart failure in 5 years, 40% risk of stroke, 40% risk of kidney failure, and 30% risk of a heart attack at 140 over 90.
So what are the numbers supposed to be, Keith?
As well, now, a normal blood pressure is 120 over 80 or less.
That's what I thought.
That is standard. Now, there is some movement with that based on other factors. Now, if you have somebody that's got a pressure of 180 over 100, they've been living like that for 20 years, and you try to bring them down too fast, they're going to feel like crap, not because that blood pressure is too low for them, which people would think that the 120 over 80 under that circumstance is. It's just the body's not used to it. They're used to, the constant beating yourself up because, you haven't sought the medical attention you need. So a lot of times we have to bring it down slower. Like I may bring them to, if they're running 180 over 100, I may bring them to 150 over 90 and leave them there for a few weeks, and then bring it down to 130s, and leave them there for a few weeks, and then get it down that way. A lot of times people will tolerate it better. Then when they get to that number, they say, man, I didn't realize how bad I felt until you got my pressure down.
So what is it about blood pressure that causes the heart to go crazy?
Look at it like this. And I'm going to give you just kind of an ideology. So let's say, that your heart's a muscle. So that muscle has to pump a certain amount of blood and pass it through your system. And it's got to get to the aorta, it's got to get to the brain and all these other organs. So if you have an intrinsic amount of blood pressure that's in your heart or in your aorta, and your heart has to pump blood hard and fast enough and strong enough to surpass what's in that vessel. I'm kind of giving you, it's a little bit more complex than that, but I'm trying to give people an idea that they can hold on to. So say if your pressure is 150, so your heart has to generate that kind of pressure constantly. Pressure in it, but the heart doesn't really like a pressure that high. It likes it lower. So if you make a muscle work harder, what is it going to do? It's going to start to grow because it's working harder than it needs to. So it's going to. That's when you hear those terms, enlarged heart. You know, can't you tell I'm into this?
Yeah.
You know?
I knew you would love this show.
Oh, yeah. When you told me we were going to talk about this, I said, oh, yeah. But I saw this to say that when your pressures get to a certain level and it has to surpass what's in that vessel, the harder or the higher that blood pressure, the harder the heart has to work. Harder the heart has to work, the more it's going to grow. That's why people's heart could get really thick and can cause heart failure, not because they have a weakened heart, but the heart is so stiff that it cannot move. You ever see bodybuilders when they get so big, their arms almost like Popeye?
They can't move their
stretch
arms.
them out.
Yeah.
So look at it, the heart can get that thick too, and that's dangerous when it gets like that because that's when that sudden death pops up. It can happen with that.
All right. So I teased this show that we were going to have real talk with our folks about some of their lifestyle habits and so forth and how that is affecting their health care. And their heart health. So what are some of the things that are prevalent particularly within the African American community that we keep doing, even though we know that it is bad for our hearts?
Oh, listen, let me tell you the ways. I mean, there's so many things. I'm saying, where do I begin? Firstly is take your medicine every day. Yeah. You are an exception to the general rule. If you look at most folks, and you don't know how many people come in here tell me a bunch of lies, and I'm looking at them, I say, I know I look like I was born yesterday. I know I do. But trust me, I was a kid once, and I had to tell a little fine white lies here and there to get out of trouble. We all had to, but some of them go way extreme with that stuff. And I tell them, I said, listen, lying to me is not helping you. Be upfront. I mean, if you're not taking it, I'd rather hear that because if I'm going to increase your meds thinking that you're taking them because you tell me you're taking them, and then when you finally decide to take them, your pressure drops through the floor because all of a sudden all this medicine that you weren't taking, you start taking, that's the problem. So that's one thing. Second thing is that lifestyle in terms of salt intake. Because if a teaspoon of salt is 2,300 milligrams. If you have hypertension, by definition, we're supposed to be looking at less than that a day. So you talk about total sodium intake. Now, a lot of people would say, well, I don't shake anything on my food. I say, well, that doesn't matter because if you look at labels, I can show you foods that got 8 tons of sodium in it, oodles and noodles.
Yeah.
Or you think about like Spam.
Yeah.
And I don't even know how people eat Spam. I'm like, that's okay. I'm passing on that one. But things in a can are characteristically the preservatives are going to be sodium-based. So you're going to have a lot of sodium in those types of foods, and that can impact significantly on your blood pressure. There was a study done several years ago, and the only reason I remember this is because I had to do a hypertension talk about this and I don't know how people did this, but they had people ingest a teaspoon of salt. I don't know how in the world they did that. And they had to drink 16 ounces of water, and they checked the pressure before they ate that salt, and they checked it 2 hours afterwards. And people's blood pressures at a median increase was 40 millimeters of mercury. So they went from 120 to 160 2 hours after they ingested this salt.
So not only is it bad when you ingest it, but it stays with you.
It stays with you. Now, it will eventually you're urinated out, but it's going to hang around for a while. And then think about it. Then you eat the next meal, and then the next meal, and you're constantly eating things that are generating that increased sodium amount, which is going to erase your blood pressure. So that's another thing. Then we're overweight, which means your potential for a metabolic syndrome, which is where you'll get central obesity, and that leads to insulin resistance. And what happens with insulin resistance, and that's why type 2 diabetics have such a high incidence of heart disease, is because when your insulin levels run high, what happens is your body becomes resistant to insulin, and so your pancreas makes more insulin because it's trying to get your blood sugar down. Those high insulin levels increases what they call oxygen-free radicals, which starts to tear up your inside of your vessels. So then you develop coronary disease and leg blockages and neck artery blockages and all this stuff that pops up because of the diabetes. So that's why type 2 diabetics is such a high risk, which leads to high cholesterol levels, which is like a vicious cycle of different things that ultimately lead to you developing heart problems.
How much the fact that we don't exercise enough, how much does that play
Big factor, because those, if you look at what if somebody says, and I get this question a lot, is what can I do? Everybody, listen, the funniest thing was people tell me they don't want to take medicine because they want to do everything natural, yet they eat unnatural, they behave unnatural, and I'm like, listen, you're 100 pounds overweight, you eat McDonald's every day. I said, how is that natural? There's nothing natural about what you're doing right now. I said, if you're going to do this, you need to do it the whole way, which means you had to cut out all this other stuff you're doing. The activity, American Heart says we're supposed to be exercising at least 40 minutes, 4 days a week of something. And that could be just simple walking. You don't have to get on a treadmill, but you have to walk with a purpose. You know what I mean? And people say, well, I walk at work. I say, you're just going back and forth to the water cooler. That's not walking. That's not walking. I'm talking about when you get out and you're actually walking with a purpose in a defined time, defined distance. Yeah. I said, and I said, if you do that, you'd be surprised what that could do for you. It'll lower your blood pressure. There are studies that clearly out there that show that if you do these things, like if you were to say cut your sodium back, lose weight, exercise, you can reduce your blood pressure by 6 to 12 points just on those things alone before you take one pill in the world. But most people won't do that. They half do it, and they wonder why things aren't going well.
You know what? I can tell you now that my husband's going to say to me, go back and listen to Keith's show again. I already know it's coming. But one of the things that you do is you actually walk and put it on Facebook and to encourage people to get out and walk. How is that working?
Well, as wintertime, I don't do as much as the summer. And then, I'm in this graduate school program, so that's been kind of kicking my tail because I'm doing 3 jobs, plus that. But I still walk every day. But when I get in the summer months, with the spring, when it gets a little warmer, that's when I really get out and do my thing. But the whole point of it is to encourage people that they have an advocate in me to encourage them to get out. Because I tell you, when you look at the data about how much you can improve your life by doing these things, that's why I go out there and do it, because it's not as hard. And I tell people, listen, I'm in it with you. I'm out there myself, and I try to do that, hoping that I can encourage people to get out and walk. And it does make a difference because I get a lot of positive response when I do those posts. Yeah. So that it's just really to tell people you can do it too. You just have to be diligent with it. And sometimes, like anything else, when somebody else is encouraging you to do something, you're more apt to do it than if you just have to go on your own.
Absolutely. 440-2665 or 1-800-940-2240 are the numbers to call to join our conversation. What questions do you have about your heart health? Are you doing what you need to do in order to stay healthy? 440-2665 or 1-800-940-2240. Keith, I know that you are also the Director of Health Equity for Sentara. What is the role of health inequities in terms of our heart, taking care of our heart in terms of getting the type of medical attention that we may need?
Well, that's probably one of the most multifaceted answers to that question, because there's so many aspects to health equity, because what you're trying to do is level the playing field. And anytime you're in there, and when I say that, you think about why do we do what we do? There's cultural background issues that are there, and there's economic aspects, psychological aspects. When you think about if you're in a position where all you can afford is the dollar value meal at McDonald's, that's an inequity, because you're working hard, but you just can't afford to do. Unfortunate reality is to eat healthy for a lot of people, it costs more. It does. Yeah. It does. And when you're trying to feed a family of 4 or 5, whatever you have, and you're on a fixed budget, that's an inequity, because you don't have what you need to make sure your family stays healthy. If the job you have only pays you minimum wage, it's hard to live off of that and to be able to do all the things to get to a gym. If you have to work 2 jobs because you don't make enough to take care of yourself, your bills, and your family, that's an inequity.
Mm-hmm.
Aspects of, how you're treated when you go to the hospital, because, there is a distress problem we have, rightly so, with some of the medical professionals, and with the system in general. So people will avoid going to the doctor because lack of trust. So you have all these different variables that impact. Partly why I do like the things with you, the other things I do is because I'm trying to help level that playing field. How do we I want people to know they do have someone in the medical profession that they can trust, that's going to tell them the real deal. And I think most people who know me know I have no hidden agendas.
Yeah.
In my quest, my Christian beliefs, my Christian backgrounds, are that I'm one to do what I need to do for other people. So that is kind of where I am. So I go out there and do this stuff because I'm hoping that if I can get this word out and people know that if I say it, it's really of value, that I'm trying to help them live their best life. That is partly my role with Sentara, is to say, okay, how do we develop programs? We have to, A, identify where the problems exist.
Mm-hmm.
B, what's the process we need to do to get people better, or get them in a better situation. You think about going to a doctor even.
Mm.
You go to a doctor's office, we got 15 minutes in the room, which if that long,
Mm-hmm.
we got to hit the 5 points and get you out. But the thing is, if you're there and you're 100 pounds overweight, by definition, you need more counseling to help you get where you need to be. Because
Right.
it's not going to be something you can do in that 15 minutes, so you need more time. But a lot of us don't have that kind of time because we're trying to because I'm overwhelmed with all the patient volume I have to see every day. So you have to have other people that help. So you really need almost like a program, to identify people that you need to that may need a little extra help.
Mm-hmm.
So designing new programs and new practice styles that may be beneficial. That's one of the other things we're actively doing with Sentara now. We're looking at opening up a clinic in Berkeley where that's going to be a different style practice, one that's going to hopefully help develop that program where we look at other services that patients may need outside of just medical stuff, that will help them live their best life.
A more holistic approach. If you're just joining us, we're talking about heart health with cardiologist and director of health equity for Sentara, Dr. Keith Newby. Just an update, they have moved President Biden's address to 1:30, so Another View gets to enjoy its full hours. So that's a great thing. Absolutely.
I was about to say, I'm going to cut me off. I said, I don't get a chance to talk about heart that much, and you're going to shorten my show.
Exactly. 440-2665 or 1-800-940-2240 are the numbers to call to join our conversation. Let's talk to AJ in Norfolk. Hi, AJ. You're on the air.
Hi, how you doing? I love your show, and it's good. I love Dr. Newby for a couple of reasons. One is his passion about what he does, and he has an awesome sense of humor.
Thank you.
Well, thank you, bro. Thank you.
Yeah, I like how you keep it 100 with a little humor to it.
Yeah.
My question was that as a child, and I kind of know the answer, but we can eat anything, and then as an adult, food can kill you. But I think I know that a lot of times, especially from where I come from, and come from a low economic environment, didn't come from money. I didn't have my own primary care doctor. My parents grew up in Jim Crow segregated South. Grandparents grew up that way, so we had no exposure. So a lot of people, I like to say they live to eat when we should be eating to live, but we don't get taught as a child. So then when you become an adult, all of a sudden food can kill you. So I know you know the answer, but I was just that's always been in the back of my mind.
Yeah, well, and again, that goes back to that cultural aspect that, how we were brought up. I came up, my mom's from North Carolina, so we came up with certain types of foods we ate that weren't deemed the most healthy. But, of course, as you learn more, hopefully you'll do better. And that's the issue, is trying to convince our folks that changing that lifestyle around, that those eating habits, because it will impact, our choices are really generally not good. And if you look at life expectancies, there's a clear difference in life expectancy amongst African Americans and whites, where African Americans live a shorter duration of time. It's usually upwards of 5 to 10 years difference in terms of longevity. And why? Because of a lot of it is due to our choices, how we live our life, the things we're exposed to. And it's deeper than just, goes back to that equity issue. It's deeper than just what you eat. Is how we live, the neighborhoods we live in. Are we in neighborhoods that have high pollution rates because of nearby factories or whatever, and there's things that impact our lives and our livelihood. So to answer the question, yes, our food choices can kill us early, no question, especially if we continue to do this on an everyday basis. Now, I know we're going to slip here and there, and it's not the issue of the slips here and there, but when you slipping every day, that's a problem.
Yeah. Thank you, AJ, for the call. We appreciate that.
If I could say one last thing before you let me go.
Sure.
If it's safe to say, Dr. Newby, can you say, I know we talk about generational wealth a lot, but can we put those two together, generational wealth and generational health? They kind of go hand in hand.
Oh, that's
absolutely.
Beautiful.
I mean, absolutely, and that goes back. That's the third part of going back to that equity issue. Because the financial aspects, it leads to everything else. If we don't have that ability, to go to how we start a business, if we can't get a loan, you can't. And if you can't get a loan, you can't do certain things. And if you feel like you're tied to just this line of work that you're currently in, but you want to progress, you want to do better, a lot of people will say, oh, just pull yourself up by your bootstraps and get out there and do X. But that's easy for some to say, but not all. Everybody doesn't have those same opportunities and that ability to go out and do that. If you're living on a fixed budget, you can't just go back to school because you got to get a loan to go to school. Yeah. And if your finances are limited, how are you going to get that loan in the first place? So it's deeper than just saying, go do it. And a lot of people don't understand that piece.
Yeah. Thank you, AJ, for the call. We appreciate that. As Dr. Martin Luther King says, it's very cruel to ask someone to pull yourself up by your bootstraps when you have no boots.
There you go.
So there
Absolutely.
You go. Our phone lines are lit up. John joins us from Norfolk. Hi, John. You're on the air. Johnny, you with us?
Yes, ma'am.
Yes.
Hey.
Hi.
So good afternoon. I want to agree with your previous caller, AJ. Love your show and always enjoy hearing Dr. Newby on the show as well.
Thank you very much.
I'm originally from New Orleans, but I've lived in Norfolk for 20 years. And, Dr. Newby, like you're talking about exercise and diet, diet with fried food in New Orleans and seafood and stuff like that. I know that's bad for you. But you mentioned a couple of other things that make me think about chronic stress. When you're talking about the neighborhood you live in and crime and jobs and finances, can you talk about that too, please?
Yeah. Oh, not a problem at all. And
Thank you, John, for the call.
And that is a big issue. You talk about stress factors and how it impacts. Stress levels increase aspects of your kind of hormone release, and which can increase blood pressure, can increase heart attack risk. Because typically when your stress levels are high, we see this a lot where people will come in with heart attacks, and have no established coronary disease, even when we do heart procedures on them. And a lot of times you'll find there's some stress-related issue that triggered that. So you get these release of these hormones and oxygen-free radicals as a result of stress that creates a milieu that can increase thrombus formation. So, when you talk about it, then, unfortunately, so we're talking about chronic stress. We're not talking about where somebody, may just have like one issue, like they got some call from the IRS said, you owe $800,000 in back taxes. They said, oh, my bad, that was a mistake. We meant to call somebody else. If they say that to you, you're going to say, okay, your blood pressure go up for a hot second, then they say they made the mistake and it goes back down. But see, when you talk about how do you take care of your family, how do you live the way you're trying to, and like for a lot of us, especially men, where we feel like our role is to care for our families and we can't do it like we want to do it. That kind of stress, dealing with that, feeling less than a man at times because you can't do what you feel your role and responsibilities are, or, if you have bills, that you didn't mean to acquire, but they just popped up, for whatever reason, dealing with all that. I mean, all those stressors can really impact negatively on one's heart condition.
So you have to take care of that stress level too. Thanks, John, for the call. We appreciate that. Keith, I got to ask you, even though I know we said we weren't going to talk about COVID, but I did see an article on the news last night that long COVID, apparently based on a study, is having a negative effect on the heart. What's that all about?
Well, essentially, this is the issue that we run into with COVID. COVID is an inflammatory disorder. It's airborne, which is why the lungs, oftentimes get infected first. So you have a scenario where you have this virus that's creating inflammation. And that inflammation can get also in the heart tissue, and that's why you hear that term myocarditis or pericarditis. That's the inflammation of the heart itself. But it also can create a thrombogenic problem where you increase clot formation, which is why people are getting heart attacks. They get pulmonary emboli, which are clots to the lungs. Strokes happen as a result a lot of times of COVID infection, because of the inflammatory response, that it creates. And then you got these long hauler people where they have, and we don't really know all the dynamics of that, why that is. Why do some people where they'll get COVID and some people recover quick and have no issues from there on. Other people can get it, and it seems to drag on and on and on. They may feel generally better, but they're still not quite where they need to be, and there's still factors with that we don't understand. But the underlying issue is that piece, is the inflammatory response that creates an issue where they get inflammation of the heart and thrombogenic properties, which means they get blood clots, and all that together is a bad recipe for a bad meal, so to speak, or disaster. And that's what we run into.
Okay. We had a call from Sherry in Yorktown. She's a dietitian, and she says, can you address the impact of salt intake on blood pressure? And what should you be looking for regarding sodium levels on tablets, on labels? On labels.
Yeah, so I tell people all the time, this is when you're looking at a label, your dietary intake, really, we usually in the heart world, we're always less than 2,300 milligrams. That's standard. So when you have less than 2,300, just less than 2,300 milligrams, that's the target goal. So when you have a target, for the day, that's the entire day. So when you look at a label, this is what I tell people that you got to be careful of. If the label says 500 milligrams of sodium, so that means by definition you could have 4 to 4.5 times that. And for the day. But the thing I tell people to caution with, you have to also look at the number of servings in that package, because if there's 5 servings in that package, that's 5 times 400. And if you eat the whole package, you're thinking, I just did 400. I got a 500 milligrams. I got a ton more I can do. That you just blew the whole thing. So you have to look at serving size as well as the actual amount of sodium that's in the package. But you want to shoot for 2,300 or less. And I try my best to tell people they really should be looking at less than 2 grams, especially if they have hypertension. But then that's not a lot of sodium.
Yeah.
That's not a lot of sodium. But you have to look for other ways to season your food that doesn't involve salt. And let's get this off the table. And this is for the whole audience listening today. All this nonsense about, I just use Himalayan salt. I don't use regular salt. Salt is salt is salt. Don't let the hype fool you. That pink salt, blue salt, red salt, green salt, I don't care. Sodium is sodium is sodium. So I want to get out, because I'm going to tell you, you'd be surprised. A lot of people say that, or they have a package that says this is low in sodium. Well, what does that mean? Low in sodium compared to what?
Compared to what? Oh,
yeah,
gosh.
So that's marketing. So you guys have to be careful with that. Look at the actual amount of sodium that's in the package and the serving size.
And you have to learn to change. I'm talking to myself. Change your taste habits so that you don't always go, ooh, this needs more salt.
Yeah, exactly. But there are other things, because I'm going to tell you, like garlic powder.
Yeah.
You think about garlic powder. Every time I put garlic powder on something, I always feel like man, I didn't put any salt on this stuff, but it tastes salty. A lot of times, there are other seasonings that you can apply that will give a similar taste to it than putting a bunch of salt up there. And I know that's hard for a lot of people to conceptualize, but I tell you, just look and try different things. Look at, and look it up, and see how to season your food. You'd be surprised. It doesn't have to just be salt.
Exactly. Let's go to Nate in Williamsburg. Hi, Nate. You're on the air.
Oh, hi, Barbara. Thank you for taking my call.
How are you?
I'm doing fine.
Good.
Thank you. About 20 years ago, I was diagnosed as a diabetic, and I also have high blood pressure. And I was recently reading an article on a hormone called aldosterone, which, according to the article, increases blood pressure by sending sodium and water into the bloodstream, increasing the volume. But this article purports that this is a curable cause of high blood pressure, and I don't think much is known about it, but I'd like to get the doctor's opinion on what he thinks about it.
Well, could you ask that first part of the question? What was the process again?
It's called it's a hormone, and it's called aldosterone.
Okay. You talking about aldosterone?
Yeah.
Okay. Aldosterone is a hormone that your adrenal gland puts out. The issue is, this is the thing. There are some secondary causes of hypertension that if your aldosterone is too high, that can lead to hypertension, but not necessarily if it's too low. But the problem is this, and what I try to convey to people is there's no fix for this. I had a patient today, literally today, he came in, his pressures were 190 over 110.
Ooh.
And he had stopped his medicine on his own without anybody getting anybody's advice, because in his mind, he said he wanted to do it the natural way, even though he was doing everything else wrong. And I had to have a talk with him about that. But I say this to say this. And he said, well, Doc, he said, I think it's a conspiracy. That's the other thing. We always talk about some of the conspiracy. I said, what's the conspiracy, bro? So he said, listen, he says, why is it that we have hypertension and diabetes, but there's no shot to fix that? We got shots to try to help people with COVID. We don't have a shot to fix hypertension. And I said, dude, firstly, hypertension is a complex problem. I said, that's not like a cold or pneumonia. I said, there's multiple factors that contribute to your blood pressure elevation. So there's no one fix, because if you say, like an example, you get this therapy, this aldosterone stuff, which I don't think is really going to really fix the problem, unless there was a problem with aldosterone in your body, and that's something your doc should be able to figure out. The issue becomes this. It's more complex, because suppose you're 100 pounds overweight. Suppose your diet is very poor. You don't exercise. You don't do anything else, and your stress levels are high. So you have these other factors that are going to supersede any therapy that you have, because blood pressure is more complex than just a simple fix. That's why people sometimes when they take medicine, they need multiple pills. And there's more to it, because I can eat myself into hypertension regardless of how much medicine you give me, if I want to. And then you talk about if the kidneys become involved, it makes it even more complex, because all blood pressure is controlled on the kidney level. So if you have kidney disease that's formulated as a result of hypertension, it's a vicious cycle. The kidneys make your pressure higher, which damages the kidney more, which makes the pressure even higher, which damages the kidney even more, hence dialysis. So, you have to look at blood pressure as being a very complex entity, as is diabetes. It's a complex thing that no one thing can fix it, per se. Now, if, say you had this hyperaldosteronism, it was your aldosterone levels are really high, you get those down. Now, that is a secondary cause of hypertension, and a lot of times if you get that under control, blood pressures will go to normal, but not always, because it depends on what the other factors involved are.
Okay.
So it's more complex than that.
Thank you for the call, Nat. We appreciate it. So we got 5 minutes left. I do have to ask you this question. Keep seeing these commercials for these home EKG tests. Are they effective? Should everybody run out and get one? does it matter, or is that something that you would prescribe?
I do tell people to get those periodically. The only thing, they're not really EKGs. They're like telemetry strips. So you get a single lead. When we look at a 12-lead EKG, that's like a 3D map of the heart, so to speak.
Right.
So there's different parts. Like, in other words, you could have one EKG lead. It could be totally normal, and the other one's messed up. So you can't tell, like, if you're having a heart attack, and you'll see that caveat on those monitors that this is not used for detecting heart attack. We do use them a lot for heart rhythm problems, because if you have a patient that may have they say they have palpitations or heart rhythm issue, and you've done tons of heart monitors on them and you just can't catch anything, if something that they may get like once every 3 months, with that type of little device could be extremely helpful, because they can keep that with them forever, really. Mm-hmm. And if they run into a problem, they can go ahead and take an immediate tracing, because a lot of times all you have to do is, even your Apple Watch has the EKG monitor on them, at least the newer ones do. Mm-hmm. But you put your fingers on the little strips they have on that thing, and it'll take your heart rate immediately and give you a EKG that downloads to your phone. You can send it, email it wherever, and those can be helpful, but for that one circumstance of a heart rhythm issue.
Oh, okay. So there are some ways that they actually work.
Yes.
I mean, and are helpful.
Yes.
But it's not the end all be all.
Yeah,
okay.
It's limited.
All right, Keith, we got 3 minutes left. I want to ask you this. So there are governors all over the country that are removing the mask mandates, and the schools, Governor Youngkin says schools are mask optional come March 1st. Should we just use common sense in terms of what we decide to do individually to protect ourselves from COVID?
Most definitely, because I'm going to tell you, I don't care what anybody says. I'm wearing my mask. And I say that because, A, the profession I'm in, B, I don't know. We still don't have the high enough vaccination rate that I would like to see. Mm-hmm. C, with this issue with Omicron, it was still passing around. Now, I've been vaccinated. I know you have, and we've had our boosters and everything else. Mm-hmm. So that piece I know we're taking care of, but the bottom line is you can still catch COVID. You can give it to somebody else. Yes, the case numbers are falling off. No question about that. Things have gotten better. But we're just coming off of that. I mean, like literally maybe like a couple of weeks ago. So people are getting, one of the mistakes I think we make is we try to do things too fast because we're impatient, and I'm okay wearing my mask still. I tell people, use your common sense, but my common sense tells me I'm going to keep it on for right now. Once I feel more comfortable, I see the case rates are staying down, then that's a different story. But I hadn't seen anything from the CDC yet saying the mask mandate, we don't recommend you wearing masks anymore. I ain't seen nothing from them saying that. So to me, why am I going to let a government agency that knows nothing about medicine, absolutely nothing, tell me something that I know I have another entity that knows a lot about medicine that's saying different? I'm going to follow what the medicine and the science says.
Okay, and in 45 seconds, in terms of our hearts, everybody get a checkup at least once a year?
At least once a year. You need to do more, especially if you have a medical condition, high blood pressure, diabetes. You're supposed to be getting checked at least every 3 to 6 months because you got to make sure. So you want to make sure that you're doing all the things you need to do. Don't assume anything. If you're in your 20s and older, make sure you're at least seeing your doc once a year. But if you have an identified problem, don't blow it off, because what you don't want to do is 10 years down the road, you have a major problem that could have been prevented had you just gone and see your doctor.
Thank you, as always, Dr. Keith Newby. He's a cardiologist and the director of health equity for Sentara. And we got to go. See you soon.
I appreciate it as always.
And we'll be right back. Good talking to you.
Hi, this is Essie Patha-Murkerson from Law and Order. You are listening to Another View.
And And after 12 years hiatus, actually, Law and Order, the original, comes back tonight on NBC. Okay, but that's the promo for that. They are 1,000 members strong and have been working diligently for the past 5 years to close the achievement gap in Williamsburg, James City County schools. In our efforts to showcase Black nonprofits, today we'd like to introduce you to the Village Initiative. Our Lisa Godley gives us an inside look at how they're utilizing mentors, tutors, and passionate advocates to make a huge difference in their community.
The Village Initiative sprung forth following a tragic loss. Founder Jacqueline Bridgeforth Williams explains.
There was a young man who was murdered in our community, Cameron Joshua Travis Stanley. And when I saw the picture of him and his mom, it spoke to my heart in such a way that had never happened before. And I felt something from that as a mother, and a mother of a young African-American son. And I looked at her son, and I saw my son and all of our sons. And I prayed and I asked God for guidance and how we can help, how we can stop this, how we can help our children. And he sent me a vision of a community organization that will be dedicated to educational equity for all children in our community. We have to give all children the tools they need to be successful, and that shows up through equity.
Her next move was to share her vision.
I just put a simple post out on social media, and so many people showed up that evening. Educators, parents, concerned citizens, they showed up.
As a result, they sent tutors to 3 locations and donated books for Head Start. But that was just the beginning.
When the COVID-19 pandemic struck early on, we took action. I reached out to my home church, which is First Baptist Church, and they provided a space for us. And we purchased groceries and went in and handed out groceries. We did that for a while, and as the pandemic got larger and spread, we knew we had to do more. Another church came on board with us, and before we knew it, we partnered also with Colonial Williamsburg, and we were doing about 750 bag lunches and box lunches a week, in addition to vegetables and fruits and things. And we were able to commandeer a partnership with another church, which is Mount Pleasant, where we provided over 2,400 boxes of food every week during the pandemic.
Village Initiative's Philip Kennedy talks about another of the organization's successes, their book boxes.
Before the pandemic hit, Jackie and I had several conversations about how do we get literacy into the community. After speaking to some of the parents, we noticed that one of the structural barriers that existed was some of our parents did not have transportation to even get to the public library. So we brainstormed, and then we met with a local church, United Methodist Church, to get book boxes built and partnered with them, and we got the book boxes built, and we ended up going to the specific neighborhood and installing the book boxes in the actual neighborhood so transportation would not be an issue as far as getting literacy into the home.
Philip says they then partnered with James City County Parks and Rec to get book boxes installed at all of their parks, and the Village Initiative refills them every week.
It's not a give one, get one book type of thing. We just want books in the neighborhood, out in the community, so anyone can just go up, take as many books as they like for free. And it has been one of the best initiatives that we as a village have done.
This team has been amazing. We've been able to do some things that I know only God could have ordained. We are doing things that are legacy building. We are packaging a gift to our community. Our Black Histories Project is a gift. We are honoring those folks who are our heroes, those that have come before us. It's so important to tell the stories, to share the stories, to empower our young people through our stories. And most of all, Village is about equity and giving every single student the tools that they need to be successful. And that's our work and our commitment to our children and to our community.
For Another View, I'm Lisa Godley.
And you can find out more about the Village Initiative at their website, villagewjcc.org. Thank you so much for spending an hour of your life with us. Do me a favor, share this show with someone who may be struggling with heart health issues. Go to anotherviewradio.org and you can download the podcast. And our numbers are slowly but steadily rising in subscriptions for our eView newsletter. It's a once-a-week reminder of upcoming shows. So while you're on our site, please sign up. We appreciate that. Next week on Another View, Dr. Eric Claville with political insight on current events occurring in our Commonwealth, our country, and around the world. You do not want to miss his award-winning Claville Report. Our theme music is an original composition created especially for Another View by Jay Sennett. Lisa Godley is our show producer. Todd Washburn is our audio engineer. And Dr. Barry Graham answered our phones. I'm Barbara Hamley. Do what you need to do to stay safe from COVID. And be sure to be civil towards those who may choose a different path. Let's get together again next Thursday at noon for Another View.
Support comes from Thomas Nelson Community College, now becoming Virginia Peninsula Community College, the first choice, whether starting your bachelor's degree or advancing your career. More at tncc.edu.
Support comes from Hampton Roads Community Foundation, partnering with donors from all walks of life to improve southeastern Virginia through grants, scholarships, and leadership initiatives. Learn more at hamptonroadscf.org.